Does your period start with some spotting? Is it brown? Your body's telling you something. I'm Mark Sklar, the fertility expert, and I'm going to teach you about your period and how it's affecting your fertility. Hi, I'm Mark Sklar, the fertility expert, and this is the first video in a series of videos that we're creating to address your periods and how it affects your fertility. So, what's your period telling you is the title of this series. First and foremost, it's really important to understand what a normal menstrual cycle looks like. And oftentimes, patients ask me why I'm asking them so many questions about their period and their menstrual cycle. Well, without a regular cycle and a healthy period, your fertility is compromised. So first and foremost, a healthy menstrual cycle is about 28 to 30 days long, and your period starts very easily and smoothly without any PMS. It's bright red in color, medium flow, no clots, no spotting. It lasts about 4 to 7 days in length, and it just goes away as easy as it came. That's essentially what a healthy menstrual cycle looks like. If you haven't been tracking your menstruation and your menstrual cycles, then I do encourage you to start tracking all the details, how you feel, what it looks like, the qualities around ovulation, menstruation, cervical mucus. Really just start to get to know your body and what it's telling you. Your body doesn't do anything by accident. All of these things are signs and signals that something is happening positive or negative in your body, and now it's your job to listen and be aware and document that information. So outside of a regular menstrual cycle, today we're talking about spotting before you bleed and brown spotting. So first and foremost, spotting is an indicator of old blood. It didn't leave your body properly the last cycle in a menstrual cycle when you menstruated, and it stayed there and collected, and now it's leaving on the subsequent cycle. Additionally, the thing that's confusing for patients is, what's day one of my cycle? Is day one the first day that I bleed? Is day one the first day of spotting? Is day one the last day of my menstrual cycle when I stop bleeding? Right? I get these questions all the time. So first and foremost, day one is the first day of full, good, medium flow. Okay? It's not spotting. Spotting is not considered day one. It's still the last days of your previous cycle. The two main reasons, actually say three, but the first two main reasons for that we would see spotting and brown spotting is, one is low progesterone. A patient's progesterone levels were too low. They didn't help support the menstrual cycle and keep your cycle length going, and so your body, as the progesterone starts to drop, your body gets signaled, and you start to bleed, and it starts to trickle and come out slowly because the progesterone levels haven't dropped completely. Two, it could be improper blood circulation in the uterus. There's not enough healthy blood circulation in the uterus, which shows that there's brown menstruation or brown spotting, and that's something that also needs to be addressed. And third, I do see this as can be an inherent weakness in a person's constitution. Could be hormonal, could be other things, so there's some investigative work that we need to do. One of the things I always like to rule out, which kind of goes hand in hand with poor blood circulation, is that if I see spotting, I want to rule out endometriosis. Spotting can be an indicator for endometriosis, and I start to look for other signs and symptoms that might be there to rule that out. If that's something you're concerned about, then I do encourage you to seek out a fertility specialist like myself who can help guide you in that and help hopefully rule that out for you. A couple key things that you can do at home to address the spotting. First and foremost, you can take some B6. It helps to support progesterone levels, and or you can take a natural progesterone cream from a compounding pharmacy. You will need a prescription to get that, and rightly so. That should be prescribed to you by a healthcare provider or a fertility specialist like myself, who can help guide and monitor that. Progesterone is a hormone. It's not something to take lightly and supplement with carelessly. So I do encourage you, if you are going to seek out that path, that you work with someone who can help guide you and support you during that phase and during that supplementation. Hopefully you found this video informative and helpful. And if you haven't already subscribed to our YouTube channel to continue to get notifications about when we post new videos, please do so. And for everyone who has not signed up to my personal newsletter, I encourage you to do it. You can do so here, and that will allow you to receive some personal messages from me straight into your inbox and receive information that I don't share anywhere else but in my newsletter. So have a wonderful day, and to your fertility. Hi, I'm Mark Sklar, the fertility expert, and if you want to learn more about supporting implantation, then keep watching because I'm going to give you my top 4 tips to support implantation.